So in this video, we are going to do a screen overlay of pig lungs and the corresponding spirometry that you see with the lungs in the state that they're in. So right now, we have the lungs on a respiratory rate of 15, tidal volume of 400, and no PEEP. And if you look at the lungs, you see with the tidal volume, you get some expansion of some collapsed alveoli, and then they de-recruit. So you get some recruitment and then immediately de-recruit. That's a sign of cyclic allostatic trauma. And what you'll see on spirometry is the whole waveform, okay? The waveform is going to look kind of like a football. The more vertical the football, the more compliant the lungs are. So if you look, this starts out, has a little bit of a baseline, it goes to the right, which is an increase in pressure without any increase in volume. So that shows you that you have atelectasis. The farther it goes to the right before it elevates, that is how much atelectasis. So that's extreme amount of pressure, and then once you overcome the atelectatic lung, it starts to recruit, and then you start to get a rise in volume. So you'll start to see, as we go up in PEEP, that this total waveform will become more vertical. It'll want to raise straight up and then come straight back down. And the overall tilt of it, so the overall slope between the lower inflection point and the upper inflection point, is your compliance. So the more vertical that line is, the more compliant the lungs are. So right now our lungs are atelectatic, so they're not very compliant. So watch as we go up on our PEEP how that waveform is going to change. So I changed it to 5 of PEEP, and you'll notice on the lungs themselves that they'll recruit and then slightly de-recruit, but not fully, because there's a little bit of PEEP on board. And it takes 3 to 4 breaths to visualize that. And if you look at our waveform, the overall slope actually increased slightly. Not much, but slightly. So let's go up to 8. And this will become more prominent at the higher PEEP levels. And you'll see that the lungs look smoother because there is no atelectasis once we get into the higher PEEP levels. Now if you look again, the slope between the 2 points is becoming more vertical, and the lungs are starting to smooth out. So we'll go up to 10 of PEEP. And again, it takes 3 to 4 breaths before you can appreciate the changes in PEEP. But just looking at the lungs right now, they're starting to smooth out. The dimpling is gone, which is the atelectatic lung. It's starting to resolve. And if you watch our waveforms, it's becoming even more. It's almost fully vertical now. It still has a slight slope, but it's not quite vertical. And our lungs aren't 100% smooth. There's still some atelectatic areas. So we'll go up to 12 of PEEP. Give it a few breaths. Keep an eye on the lungs. And our waveform is almost vertical now. It's almost going straight up. Visually, we are starting to see that the lung is no longer atelectatic, and we're having a sharp inflection point straight off the baseline pressure, and then it comes back. We'll go up to 15 of PEEP and see what our lungs look like at the final PEEP of 15. So the lungs overall look fairly smooth. Our waveform again is coming straight off baseline. It's not riding the baseline pressure then rising. It's coming straight up and off. The reason you want that, the lower inflection point, the point at which it comes from a horizontal to a vertical axis, that is your P flex, and that's what we want. We want the P flex to be at the baseline so that it immediately comes off baseline and makes a vertical rise. If it ever rides the baseline pressure, that's showing that you have unresolved atelectasis. And to compensate for that, you can do a recruitment breath, you can increase your PEEP, you can just steadily go up on your PEEP like we just did, and then come back to a PEEP level to where you still have a vertical rise as soon as the breath starts. And honestly, the lowest setting, or 1 to 2 above that, where you go from a horizontal to a vertical rise to a straight vertical rise, that's the ideal PEEP setting for that patient. And with spirometry, we can visualize it very quickly. We can make adjustments in real time. If you don't use spirometry, or you don't have a ventilator equipped with spirometry, then it becomes a negative feedback system. So you go up on the PEEP, You look at your volumes that were returned, you looked at your peak pressures, you look at your oxygenation, and you basically find the point at which you have the best oxygenation, the greatest volume with the least amount of pressure, and you're using the least amount of oxygen to oxygenate to the SpO2 that you choose. That's basically our quick tutorial. Again, looking at the spirometry for this patient, it's very vertical. There's no atelectasis on the spirometry, and there's no visible atelectasis in the lungs. So spirometry, again, is a great surrogate to see what's actually going on inside your patient.